World Health Organization declares monkeypox outbreak a public health emergency of international concern. Good evening. I'm Sarah Amanda, and this is Freedom Square News. Tonight, we begin with news from the World Health Organization. The Director General, Dr. Tedros Adhanom Ghebreyesus, has declared the ongoing Mpox outbreak in Africa a public health emergency of international concern, or PHEIC. This declaration comes amid an alarming surge of cases in the Democratic Republic of the Congo and its neighboring countries. The upsurge of this once rare disease has now raised fears of a wider international spread, prompting a call for immediate global action. In a statement issued earlier today, Dr. Tedros expressed deep concern about the spread of a new strain of Mpox in the DRC, known as Clade 1b, which appears to be transmitting predominantly through sexual contact. The strain has already been detected in neighboring countries including Kenya, Rwanda, Uganda, and Burundi, where over 100 laboratory-confirmed cases have been reported just this past month. Mpox, which was first detected in humans in 1970 in the DRC, has been largely endemic to Central and Western Africa. However, in recent years, the virus has caused outbreaks in countries outside the continent, with a notable global outbreak in 2022 that spread rapidly through sexual networks. Though that outbreak was declared over in May 2023, new challenges have emerged this year. The WHO reports that over 600 cases have already been documented in 2024, alongside a death toll of 537, numbers that have quickly surpassed last year's figures. The DRC continues to be the epicenter of the crisis. Dr. Matshidiso Moeti, WHO's regional director for Africa, stressed the urgency of the situation, stating that communities and governments are working tirelessly alongside WHO teams to reinforce containment measures. However, the spread of this new Mpox strain calls for more coordinated international efforts to stop the virus from expanding further. But what exactly is Mpox, and why should the world be concerned? Mpox, formerly known as monkeypox, is a viral disease caused by the orthopox virus, the same family of viruses that includes smallpox. Mpox was first identified in monkeys in 1958, but the virus primarily circulates among rodents and other small mammals. The first human case was recorded in 1970 in the Democratic Republic of the Congo, where the disease has been endemic for decades. The disease spreads through close contact with an infected person or animal, as well as through contaminated materials like clothing or bedding. Transmission can occur through direct contact with skin lesions, especially in the mouth or on the genitals, respiratory droplets from prolonged face-to-face contact, touching items contaminated by the virus, such as clothes, linens, or surfaces. Animal-to-human transmission can also occur, particularly from animals like rodents, which may carry the virus. People can get infected through bites, scratches, or activities like hunting, cooking, or handling infected animals. What makes Mpox particularly concerning is its potential to spread rapidly in both humans and animals. Symptoms typically appear within 1 to 21 days of exposure and can include fever, swollen lymph nodes, headache, muscle pain, backache, and, most notably, a distinctive rash that progresses through different stages. This rash often starts on the face before spreading to other parts of the body, including the hands, feet, and genitals. While most cases resolve in 2 to 4 weeks, the virus can be more severe in those with weakened immune systems, and in some cases, it can be fatal. The outbreak we are seeing today has evolved from earlier strains, with Clade 1b emerging as a new, more transmissible variant. This strain is spreading through sexual contact networks, but Mpox is not limited to any one form of transmission, making it a public health risk that must be addressed globally. To combat the outbreak, WHO is working with vaccine manufacturers and global health partners to ensure that vaccines are available to those in need. WHO's Strategic Advisory Group of Experts on Immunization has recommended 2 vaccines currently in use for Mpox. Plans are also underway to accelerate vaccine access in lower-income countries through the Emergency Use Listing procedure, allowing international agencies to procure and distribute vaccines quickly. In response to the escalating outbreak, WHO has released $1.45 million from its contingency fund for emergencies to support surveillance and response activities. The organization is now appealing to international donors for an additional $15 million to continue scaling up efforts. As this story develops, Freedom Square News will continue to bring you updates on the situation and the global response. For now, experts are urging the public, particularly in affected regions, to take precautions and stay informed about the latest guidance from health authorities. This is a pivotal moment, not just for Africa, but for the entire world. Let's hope that with swift, coordinated action, we can bring this outbreak under control before it spreads even further. I'm Sarah Amanda, and you're watching Freedom Square News. Stay with us for more updates throughout the evening.
Freedom Square.